Hey, it's Dr. Schmidt. I want to go over some heart tests and explain them to you. And this is bigger picture stuff. This is a way to look at the heart that makes sense in a chronological viewpoint and actually like where to focus your attention on first. And what we have in the office is what we call the heart travel package. We have several people who have already done this. They come in for 5 visits in 3 days. And you can contact our front desk team if you're interested in coming into the office. And one of the main features is getting this test run. We have other tests too, but this is called the heart sound recorder. So this is a person, I saw him last week, Tuesday, Wednesday, Thursday. 5 visits. This is the first visit. Now, when you look at this test, we have 4 valves. We're detecting the motion of the 4 valves. Here's the first one. It's just up and down. This is constant flutter right here of the mitral valve. The second one is a tricuspid. Just look at my cursor. And this is not too shabby. The heart goes lub-dub. Here's the lub. There's the space and then the dub. And then rest. The rest has a little bit of flutter right there. And then we do it again. Here's lub. And then the space is non-existent. And then the dub. We want that space right here to be flat. The pulmonic valve at the very bottom looks the best of all 4. So we have lub, and then not much space, and then dub, and here's rest. So at least this part of the heart is showing some ability to rest. But this right here, the mitral valve, is completely out of control. I put him on supplements on the first visit on Tuesday morning. He came back Tuesday afternoon. I put him on some more supplements. I did the muscle testing to figure out what his body likes the most. I have a booklet to help me understand like what to address based on this heart sound recorder. And then on the second day, this is what happened. We did it again, and you can see the mitral valve is so much better. We have more of a resting period here, and the ups and downs are gone. And let me show you again like how wild this is on the first day and how much better this is on the second day. And now the tricuspid valve, it looks kind of the same, just a little bit more wild than even on the first day. And I'm going to just bump right over to the third day. You can see how much better this is. So just showing you once again, here we have lub, space, dub, rest. And then lub, and we're missing the dub here. Okay, here we have lub, space, dub, rest. Lub, space, dub, rest. There's room for improvement with these two, but just look again. Okay, the first day, look how wild it is. Look at this aortic valve here on the right. And then on the third day, look how much better this is. The aortic valve this is perfect right here. The beat of this, the motion of this valve is perfect. Lub, space, dub, rest, and that rest is nice and flat. So, and he felt better on the third day. He said he felt calmer on the inside. His heart wasn't all like wild out of control. I've had about 5 people do this 5-day travel package, and there are other conditions associated in the body that need to be improved. So one woman had constipation her whole life, and she came in for this heart travel package, but you can't just fix the heart and not address anything else. So on the third day in the morning before she came into the office, she had a bowel movement on her own for the first time in her life because of the supplements that I put her on. Now, a lot of people that already come to see me, they've seen a lot of my videos, they've already changed their diet's much better. They're eating more protein, lowering the carbs. So that's good. And but it's nice to have those 5 visits so that we can have some like breathing room. And then I recommend a supplement or more than one supplement, and I am adjusting the program and monitoring over the course of those 3 days. And by the time you leave, I want you to be happy and I want me to be happy. Like it has to be a mutual like win-win, and I have to be satisfied that that particular program I have you on is going to benefit you at least for 4 weeks, and then we could talk on the phone. And there was a woman that I saw too. She had a chest pain, tightness like this, and her blood pressure was coming up, and this had been happening for about 2 weeks, but it happened prior about 4 years ago. And what was the situation there? Well, I figured out it was actually her gallbladder. And both times when she had this symptom, it was from eating foods that she wasn't accustomed to due to traveling. So you can have a lot of like heart symptoms, and it's actually coming from the gallbladder or the stomach, digestive distress. That's why heartburn is called heartburn. The heartburn symptom usually it's usually like stomach related, but it's very easily confused with a heart situation. So heartburn is, like a digestive symptom cause that mimics a heart pain. Okay, I'm going to switch gears now and talk about another test, another lab. Here's this other lab. Okay, so picture this, female, Lyme disease, thyroid dysfunction, and in the last 3 months, her joint pain and fatigue and everything is 50% better. I've had her on low carb but not ketosis, and we've been killing fungus out of her body and doing other things, and she gets this test run, and there's a lot of red there. Now, her total cholesterol is high, LDL is high, HDL is low, and we have other inflammatory markers, lipoproteins, that are all high. And here we have more inflammation, fibrinogen, CRP. These are high. We want these to be lower. So let me show you the next page. Now this page is also, there's a lot of red, and this has to do with diabetes and sugar. So we have glycemic control, insulin resistance, and beta cell function. Beta cell function is how the pancreas is working. So the question, and so like when she showed me this lab test, the question is, how's my thyroid? And out of the 5 thyroid tests that were run, there was one that was high, thyroid peroxidase, which means autoimmune disease of the thyroid. But it was only high by about 3 points. Not a big deal, and she's already on supplements that would address that. And so I had to redirect her back into these 2 pages that are bright red, and now we have to look like, what do we do about these? So we have, a couple dozen red boxes. What do you do with them? Do you add a supplement to reduce the leptin? Do you add a supplement to reduce the ferritin? Do you add a supplement to reduce the C-peptide? Do you add a supplement to, see what I'm saying? You can't address all this stuff allopathically, and that's what allopathic medicine is. You find something high or low, and you treat it on the paper, and you make it go back to normal. And usually they do it with drugs, but a lot of holistic doctors will do it with supplements, which is better, but you still don't want to do it allopathically. So here's my message to her. Of these 2 pages, one is more important, and that's this one. It's the glycemic control diabetes. It's the insulin resistance. This is the most important page, and when this is normal, usually this becomes normal, the heart stuff. So let's go back to the glycemic control. Now, of all these labs here, what's the most important one? Well, the most important one isn't even on here, and that's ketones. And I said to her, now it's time to get into ketosis, and now that your body is 50% better, you've wiped out a bunch of organisms like fungus. Now it's time to get into ketosis. So let's start. And so that is the number one lab test for a lot of people. Ketones. Once the ketones are up, the blood sugar comes down, the insulin comes down, the A1C comes down, the inflammation comes down. And then, now we're talking cardiovascularly, LDL normalizes, HDL and total cholesterol, they all normalize within their respective ranges. Meaning you can have higher LDL, but the HDL goes up also, and the triglycerides plummet. And so like in relationship to each other, they all become normal. And the fibrinogen, that's right here, down here, that's an inflammation, the C-reactive protein inflammation. All these things come down with ketosis. So let me just restate what I just said. This page right here is the most important one. It's blood sugar control. The most important test is ketones. You can test that at home. You can use a Keto Mojo. This page right here, even though there's a ton of red, it looks really scary. A lot of heart markers are high. This is secondary to blood sugar control, and just watch all these things normalize over the course of months. And once you're in ketosis, 3 months later, you have significant improvement, and then continued improvement for 6 months, 9 months, a year. And then you can add some supplements to speed this along. But the diet is the foundation, and the supplements are supplemental to a good diet. Now, does meat cause any of this? No. Only plants do. And when I say plants, I'm talking about the seed oils, the vegetable oils. I'm talking about sugar. And then I'm talking about some very inflammatory plants for some people, such as nightshades, for example, or some people react to oxalates like spinach, like kale, etc. So those are food allergies. Now, she also brought me a whole packet of food allergies. And usually when I get a packet of food allergy testing, I just set it down, and that comes later. Now, clinically, the patient has to figure out on their own. I eat dairy, like if they eat dairy and they get mucus, stop the dairy. If they eat some dried mangoes and then they have to put their head down on the desk, obviously you got to stop that. It's too much sugar. So clinically, you have to experience these things for yourself and make determinations on what you're eating based on your clinical results. But usually those lab tests I'm not so fond of. So there you go. I just wanted to run this by you so you can have a bigger picture on lab work and how I approach this, as opposed to trying to figure out each number individually. It's the ketogenic diet, higher protein, and you can have higher fat or lower fat, but it's got to be healthy fat. So if you're interested in coming into the office, please email intake@thenhcaa.com, and you can call the phone number. And I would really appreciate if you share this video with anybody interested in improving their heart. And you can have a healthy heart. You can be 40 years old and be very athletic and trim and muscular. But if you have that genetic component and you've never been in ketosis and you don't know what your lab results are, you got to investigate this. I have a friend, he died when he was 42 years old. He was raking the leaves and he just dropped. And I had a patient today, he said his best friend was 31 years old, had a heart attack and died. So these are sneaky, especially when you can have like a little nanobacteria sitting in your arteries, laying down calcium and causing plaquing. So that needs to be discovered. So anyways, we have 5 practitioners in the office. We all do nutritional care. We can do phone consultations. People can fly in from out of state, and they can spend 2 days with us or 3 days with us, depending on the travel package that they choose. And we can help you improve your health. So give me a thumbs up, share, and subscribe.